Hey everyone. So I'm just gonna go over a brief anatomy and physiology of the cardiac system and some pharmacology, like some related drugs to the cardiac system. Since this week we're gonna cover the cardiac system, and obviously the cardiac system it involves with the heart. So first and foremost, take out your index finger, middle finger, and your thumb. Now do this. Okay, so your thumb is like right here, your index is right here, your middle finger is right there. This middle finger, so so basically the heart has like certain branches, three different branches of arteries. I'm gonna discuss more about arteries and veins in a bit, but here you have three major arteries by doing this. So, oopsies. This middle finger is the circumflex artery. This index finger is the left anterior descending artery, and this thumb right here is the right coronary artery. So this thing, if you were to hold your heart like this with your middle finger, your index finger, and your thumb, then this middle finger, your circumflex artery, index, left anterior descending artery, the thumb, right coronary artery. And then speaking of arteries, we have this phrase that you probably want to memorize. So I have it right there. Yeah. So this is basically from my old anatomy physiology notebook from yay 9 years ago. So this phrase, stay away because I'm vain. Again, stay away because I'm vain. So what is that phrase? Why am I doing that phrase? Well, arteries goes away. The blood pushes away from the heart. Whereas the vein, VEIN, even though I said VAIN, it's VEIN, the blood returns to the heart. So stay away. Arteries moves the blood away from your heart because the vein returns the blood to the heart. And then there's this convoluted process of how blood, deoxygenated blood flows. So it starts off from the body to the vena cava into the right atrium, through the tricuspid valve to the right ventricle, flows out to the pulmonic semilunar valve, and then venous bridges through the pulmonary artery into the lungs. So that's the oxygenated blood, if I'm not mistaken. And then here comes the oxygenated blood. So from the lungs to the pulmonary vein, through the left atrium, to the bicuspid or the mitral valve. Let's call it mitral valve. Easy to pronounce, yeah. Okay. So from that to the left ventricle, to the aortic valve, to the aorta, and then back to the body. I don't want to repeat it again, but you can rewind and then hopefully it'll click. So so of course the heart has three major layers: the endocardium, myocardium, and epicardium. Epicardium goes first, then the myocardium, then the endocardium. So just a little quick review on that. So I mentioned about the valves, right? Okay, so here's kind of like the structure. So just think of it like you're holding on a parachute. The top part, that's the valve, or we call it the leaflets. It's attached to the chordae tendineae, so it's kind of like a strings, almost like the string structure that holds with the papillary muscle, which is the one you hold. So if imagine holding a parachute, okay. So you have the top part as the valve, the leaflets, the strings holding while you're holding. So you're holding the papillary muscle, whereas the strings that's connected is the chordae tendineae. If you want to see it like in real life, oh, shh, don't tell my mom. I'm gonna use my mom's bra. So this is what it would look like. So you have the valves, the leaflets, hold it like this. So these strings are the chordae tendineae, and then I'm gonna hold it right here. The one I'm holding, my fist. See my fist? That's the papillary muscle. So leaflets, chordae tendineae, and what I'm holding onto, papillary muscle. Okay, so the heart has its own cardiac conduction system. So you saw probably in the health assessment notebook, health assessment textbook. It looks kind of convoluted, but let you remember. Just think of it as like a squid. So I'm gonna show you up close. So if you can see it, can you see it? Okay. So yeah, so just think of it as like a squid. You have the sinoatrial node on the top. Down the middle, as you go down, you have the atrioventricular node, all connected with the bundle of His, all the way down to the Purkinje fibers. So the SA node is, so that area is where the atrial muscles contract. This is known as the pacemaker. And as you go down to the atrioventricular node, this one serves as a pause because it delays the impulse by 0.09 seconds. And then you have the bundle of His, that's the connection right there. It connects to the Purkinje fibers. So this is where the ventricles are contracted. So I included a little mnemonic below. Save His Purkinje fibers for His myocytes. So the myocytes is where is it? Right here. The myocytes is where the Purkinje fibers are connected. So they're like the Purkinje fibers, like the dendrites that connects to the cardiac myocytes. So just think of the system as like a squid or octopus, whatever floats your boat. Okay. So okay, I wrote out like a lot of things, so I'm just trying to condense it. So we have this P wave, the QRS complex, and the T wave. You will probably learn more about that when you reach the health assessment lecture or lab, depending on who can describe better. So the P wave happens due to atrial depolarization. Then you have the QRS complex due to ventricular depolarization. And then last, the T wave is caused by the ventricular repolarization. So P, QRS, and T. Atrial, ventricular, ventricular. Depolarization, depolarization, repolarization. So that's that. And so, okay. So I have mentioned about, we're going back to this, right? To sinoatrial, atrioventricular, and Purkinje fibers. So we all know that a normal pulse is about 60 to 100 beats per minute. Coincidentally enough, it's the same for the sinoatrial node. It's also 60 to 100 beats. But as you go down each of the system, the numbers actually goes down because, as I mentioned earlier, the atrioventricular node, that's where the thing starts to pause, and then the bottom is where the bottom part of the ventricle starts to contract. So the numbers are going to get smaller and smaller. So sinoatrial node, 60 to 100 beats per minute. But atrioventricular, because of that pausing mechanism, it's about 40 to 60. And then the Purkinje fibers, it's about 20 to 40. So just think, 60 to 100 for the SA, 40 to 60 for the AV, and then 20 to 40 for the Purkinjes. Just remember that, right? And then going back to the P wave, the QRS, and the T wave. So keep in mind that there are three elements that would actually affect it. Goes up, the intensity of the waves. So we have calcium, we have sodium, we have potassium. These three elements are actually works as switches. So that controls normal heartbeat, irregular heartbeat, and yeah, so basically those two things. So around the P wave, we have calcium. Calcium is the on switch. And then the QRS, around the QRS, you also have sodium. Sodium is involved. It's again, it turns everything on, and the PQRS T. So about the S and the T, because we have PQRS, PQR, that's a calcium, and then there's a sodium involved, and there's the ST segment. The ST calcium is still involved, but then up to the T wave, that's when potassium comes in. That's the switch. Potassium actually turns it off. So again, sodium, calcium, potassium. Sodium turns it on, calcium turns it on, potassium turns it off. So just think sodium on, sodium on, calcium on, calcium on, and potassium off, potassium off. Just think sodium on, calcium on, potassium off. Wait, let me say it slower. Sodium on, calcium on, potassium off. Okay. So, of course, we have certain conditions such as hypertension and hypotension. Hypertension, high blood pressure. Hypotension, low blood pressure. But there's also something called deep vein thrombosis, and I want you to remember this because there's actually like a diagram to help you remember the contributing factors. So just think of Virchow's triads that shows the factors information of thrombosis. We go by the acronym, and I'm so sorry in advance. It's very unfortunate because it's actually a bad word. Just think SHIT. Yeah, SHIT. 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 S stands for stasis, where it's standstill, no movement at all. H is hypercoagulability, so that's when there's the clotting going on, where it gets very clotty, very sticky. And I is injury, specifically venous injury. All of these will lead to thrombosis with T. So S, stasis. H, hypercoagulability. I, injury. All leads to T, thrombosis. Shit. Okay, so that's a little brief of that. And then, of course, you have the prescriptions. We call it the anti-arithmetics. Goodness gracious. Anti-arrhythmics. Bingo. Anti-arrhythmics. Those are the treatments for those cardiac conditions. And it breaks down into 4 classes. You have class 1, class 2, class 3, and class 4. Class 1 are the sodium blockers. Class 2 are the beta blockers. Class 3 are the potassium blockers. And 4 is the calcium blockers. So, sodium blockers, class 1. 2, class 2, beta blockers. Beta blockers. I think I probably said something wrong, but class 2 is beta blockers. Class 3 is potassium blockers, and of course 4, calcium blockers. So I want to focus more on the beta blockers, class 2. There are some drugs that ends with LOL, LOL, or OLOL, OLOL. How are you going to remember those drugs are suitable for the heart? Okay, another finger exercise. Put out 2 index fingers. Alright? Now, these fingers are represented as the L's because again, LOL, OLOL, OLOLs, and LOLs. Those are for the heart. Put your fingers out. Fingers out now. One of the fingers will be staying like this. Wait, hold on. Okay. Whereas the other finger, you have to do like this. Alright? Or, you know what, let me... So... can you see? Okay. Let me do this. You know what? let me just show it right here. So, 2 fingers up represents the L. Do this to one of your fingers. You can do like this, or you can do like this. But one finger has to be standing up, the other one has to go sideways. And I'll show you why. So, we know that we have class 2 or the beta blockers. You know what, let me just give you like a quick refresher. So we have beta 1 and beta 2 receptors into our system. Where would you find, so think of it this way. How many hearts do you have? 1, right? Okay. Where do you find beta 1 receptors then? Right, in the heart. So beta 1 receptors are found in your heart because you have 1 heart. Now, how many lungs do you have? 2, correct. So where would you find beta 2 receptors? Yep, lungs. You find beta 2 receptors in your lungs because you have 2 lungs. But let's focus more on the cardiac because, as I mentioned earlier, you find beta 1 receptors in your heart because you have 1 heart. Now, let's go back to the finger exercise again. So, again, one has to be standing up, other one has to be sideways. So, just take your pick. Okay, so, beta, so, prescriptions with ends with LOL or OLOL, just know that they are beta 1 blockers. Let me try it again. 2 fingers. They represent the L's. OLOL or LOL. Okay. One finger has to stand up. Another finger has to go like this, sideways. So, prescriptions with LOL or OLOL are beta 1 blockers. Let's do it again. OLOLs and LOL medications, so OLOL or LOL drugs, are beta 1 blockers. Got it? Alright. So that concludes the quick review of anatomy, physiology, and a brief pharmacology of medications for the cardiac system. And you'll probably learn more about other medications associated with the cardiac system when you reach pharmacology. So yeah, so just a little brief stuff. So if you have any questions, just don't be afraid to ask me. And I'll see you guys soon.